Well, hello, it's Wellness Wednesday again. I'm Dr. Rose Hollow, a board-certified naturopathic doctor and a licensed ecclesiastical holistic practitioner. And I work here in Defiance, Ohio, which is located in Northwest Ohio. And I see people in the office, and I also see clients via telehealth. And I guess this is going to be part of a series because it's been really a lot of people have inquired about this both through the channel and private messaging about estrogen dominance and bioidentical progesterone usage. So I'm going to do another video today on the symptoms of estrogen dominance and then how to actually apply the bioidentical progesterone cream if you elect to purchase and use it for yourself. A lot of people do this DIY, so this video is not intended to diagnose or treat any of your health conditions. If you need a professional to help you, please contact one. This is just for informational or educational purposes and for me to share my own experience and that of some of my clients and colleagues. So first of all, what is estrogen dominance? Well, it's basically, it's not exactly a diagnosis at this point. It's kind of just a collection of symptoms that happen because the ratio between the amount of estrogen in our bodies and progesterone is a bit off. So for a lot of us, no matter what we do, we still have a higher ratio of estrogen or a higher amount compared to the amount of progesterone. So when you go and get blood tests or a urine test or something to measure your hormones, you may see that your hormones are within that normal window. You could be higher or low, but a lot of times those of us who have estrogen dominance are still in that window of normal. So your doctor is going to come back and say everything's normal. But that may not necessarily be true for you because you may still be experiencing symptoms related to your menstrual cycle. This especially seems to be a problem for people who are in that perimenopausal stage. So like me, you may be late 30s, in your 40s, maybe even approaching your 50s, and you are experiencing very severe symptoms related to your cycle because things may have been difficult before, but when your cycle starts to get a little bit confused as you age, those symptoms just get so much worse. So this is the point in life where a lot of people really start to complain. There are so many symptoms, and I will go over that in a minute. But I wanted to say first, if you are not already, I really, really encourage you to get an app for your smartphone and keep track of your cycle, especially if you are irregular. Not only can this help you determine when you are fertile and when you're not, if you're concerned about that, but it will also help you to get an idea of the correlation between the symptoms that you are having and your cycle. So you will be able to see if there is some sort of link between the symptoms that you are having, whether they are physical or mental, and where you are in your cycle. And I can tell you that I've been doing this for many, many years for myself, and I have definitely noticed that there is a correlation between many of my symptoms that I never thought would have been hormone related that actually are related to my cycle. They come and go during certain times of the month, and these symptoms come together as kind of a package deal. When I'm having one, I tend to have the other. So I've been able to figure this out for myself by tracking my cycle with an app for many years. It really empowers you and gives you a sense of what's going on and gives you a little bit more information to work with. So do that if you haven't done that already. I really like the Clue app. If you have a smartwatch, like an Apple Watch or something, there are ways to track your cycle through that app as well. So anyway, back to the subject. So I talked about how estrogen dominance symptoms can be mental or physical. So if you have had your testing done and you're still falling within that window, there is actually a way to measure your ratio. If you're worried about your symptoms, there are progesterone estrogen ratio calculators online where you can actually put in your lab numbers and see what your actual ratio is, because that matters more than anything when it comes to the estrogen dominance bucket of symptoms. So if you see that your ratio is really at an undesirable level and you do have these symptoms, then, you know, we're correlating, we're triangulating all this information, and we're saying, you know what, there probably is something going on here. So what are the symptoms? Oh my gosh, there's so many, because we are human and we are all different. We're all exposed to different things in our environment too, from plastics to air pollution to, you know, genetic predispositions for this. So it really depends on you, your body, what you've inherited from your mom and your grandma, and all those kinds of things. So mentally, if you have ever had symptoms of postpartum depression or postpartum psychosis or things like that, that could be estrogen dominance related. I'm not saying that these things are, but for some people they are. Are you internally anxious but outwardly calm? Do you have frequent complaining or crying? Do you have an absence of maternal instinct or the maternal behavior? Do you have a lot of feelings of resentment? Have you been depressed during a change in your cycle? So say you're going from having a normal cycle to those perimenopause years when things are changing. Are you really depressed during this time? Easily upset, quick to cry, lots of feelings of guilt. And I'm talking about, like, every woman has guilt, right? But I'm talking about like obsessive, overwhelming feelings here. Have you ever had hallucinations? Lack of self-confidence or self-esteem? And a lot of these mental health symptoms, if you track your cycle like I've suggested, you will see that these symptoms are worse during certain times of your cycle, and you will see a pattern start to emerge where, like, oh gee, you know, on the 28th day of my cycle every month, I seem to get really, really anxious and I yell a lot. You know, so that's why we keep track of these things, so we know if they're related to our hormones or not. Do you have seasonal affective disorder? This, you know, and these things can be related to a lot of different factors, because when we're talking about hormones, we're talking about gut health, we're talking about nutrition, we're talking about external stress and how we're managing that and these sorts of things. But thinking aloud here and trying to put some information together. Do you have agoraphobia, where certain times of the month you do not want to socialize, you do not want to leave your home, you do not want to go around people? And then another thing too is that melasma can be part of this. So there are women, and myself included, who have dark patches, and they're hard to see here. Maybe you can see one over here. But, and I have one up here too, but I have makeup on. But anyway, there are these darker patches of skin, and the skin can be a little bit irregular, and that can be also related to estrogen dominance. There are so many symptoms. This is just a short list here, but if you are tracking your period and you're noticing that these symptoms are cropping up every month over and over, and they are at the point where it's interfering with your life in some way, this is where we start to suspect that we have that these symptoms are related to the estrogen progesterone ratio being off. So I hope that that helps. I know it's a little bit of a loose explanation here, but I think the keys are understanding that the symptoms are very many and varied from person to person, and also that you won't know if they're related to your hormones unless you are tracking your cycle. So you need to do that for sure. Okay, so how do we apply progesterone cream? How do we get started? In my last video, I talked about some of the misconceptions about dosing of progesterone. If you'd like to go back and watch that video, please do so. But just for a review here, the recommendation really that I give people and that I use for myself is a minimum dose of 100 to 200 milligrams per day of topical progesterone, whether it be an oil or a cream. It would be different for an oral dose, possibly different for a vaginal suppository. So you definitely want to discuss those things with somebody who knows what they're doing, like a health professional or a colleague or a friend who have experience with this. Okay, so we use 100 to 200 milligrams per day for the purpose of avoiding the problems of estrogen dominance and the symptoms associated with that. And a lot of times, a lot of progesterone cream is needed in the beginning. So for example, I know someone who uses 800 milligrams twice a day. This is quite a whopping dose, but this person has estrogen dominance related seizures, severe migraines, right-sided weakness, things like that, that are, very severe symptoms that are estrogen related symptoms. So this is somebody who's has been very off balance. For you, it may not take as much. It really depends on the person. So when you're starting out, I recommend getting a cream where you can get a dose of about 100 milligrams per pump. And you want to split your dose. So the progesterone, when we absorb through our skin, it lasts about 12 hours, or it's effective in our bloodstream for about 12 hours. So it's really important to do dosing at least twice a day, unless you want to spread it out over the course of the day, which is fine too. It's important to remember, if you are someone who works out a lot and you do a lot of cardiovascular activity, it may be better for you to spread your progesterone usage out throughout the day, or make sure that you're getting one of your doses after you work out, because when you work out, when you eat, when you're stressed out, you're burning through a lot of progesterone a lot more quickly. So if you feel like that pertains to you, you may want to space your doses out so that you're getting a dose of the bioidentical after something like that happens. So some people like to do it after a workout. Some people like to put it on after their biggest meal of the day. Some people keep a little in their purse, and if they get really stressed out, they apply a little then. The trick is to not go down in dose. So if you increase your dose, it's good if you're using this as sort of a treatment, and that's quote unquote treatment because we don't treat things here, but if you're using it as a treatment for estrogen dominance, you do not want to go down in dosage once you increase. So let's say you start out with a pump of 100 milligrams in the morning and 100 milligrams at night. And then one day you get a really bad migraine and you put a little progesterone cream on the back of your neck. Whatever you have put on there, that you've increased your dosage. You do not want to go down because you're still having estrogen dominance symptoms. If that progesterone cream helped your headache go away, then you need to stay on that dose. I hope that makes it clear. So, and you want to keep increasing your dose until your symptoms really start to die down. Now, in the beginning, you're probably, if you have really severe estrogen dominance type symptoms, you're probably going to experience that estrogen kickback that I talked about in my other video. So if you're having a lot of that and you feel like the progesterone is making things worse, a lot of times people do experience that at first. It's important to know that you kind of do have to stick with it if you want relief of those symptoms, and you may need to increase your dose slightly or a lot. So over time, you want to increase just a little at a time. If you increase a whole bunch all at once, you could be setting yourself up for feeling really gross. And I think it's important to know too that this sort of DIY therapy you're not going to have immediate results. You're probably going to see results after using this through a few cycles. So a lot of people like to work their way up to their higher dose, and then once you find your ideal dose where your symptoms are really like giving you, where you're getting some relief, where you're able to function through the day throughout your cycle, then you want to stay at that dose for about 6 months or so. Some people stay on for 1 year to 2 years. The person I mentioned before has been on a high dose for almost 2 years and needs to stay at that dose for now, and will possibly, you know, adjust later on. So bioidentical progesterone cream is very expensive, unfortunately, especially if you're a DIYer, so you're buying it online. The best bang for your buck is definitely Ona's natural cream. You can go to their website and buy their cream. If you would like a discount code, I have one. Just hit me up for that, by the way. And sometimes they have things go on sale too. So I would definitely recommend Ona's. I've had really good luck with that brand as well. But you have to keep that in mind when you're going up with your dosage, that you want to get to that happy place where you're feeling better, but you're not using so much cream that you're not going to be able to maintain that over a period of 6 months or so because of the expense. So it's also something to keep in mind as you're doing this. You want to go slow and make sure you find that happy dose, but not too much where you're just throwing your money away. So okay, so how to put on the cream. If you're using a whole lot of cream, you're gonna need to put it all over your body, unfortunately. I have found that the backs of my arms work very well, the backs of my legs behind my knees. Sometimes I put it on my feet, I put it on my neck, I put it on my back. Sometimes I put it on my face. If you put it directly on your face, it can help melasma spots. But basically just rub it all over. If you can change the spot where you apply it pretty often, I think that helps with absorption. And then definitely the cream is very thick and a little bit sticky. It's kind of hard to rub in, so you want to get it in pretty quickly. You know, if you're doing like a couple pumps, I would do 1 pump, rub it in, do your next pump, rub it in. If you're trying to do too much at once, it tends to be too thick to actually rub it in before it is absorbed. So that's kind of how I do it. Do 1 pump at a time, rub it in, do your next pump, rub it in. Moving the area around. So hopefully that makes sense. It's important to make sure if you're buying bioidentical progesterone cream that it says USP, and that also if it's made with vitamin E oil, it helps with the absorbability of it. That's why I like Ona's so much, because a lot of the ingredients that they use are clean, they're more hypoallergenic, and they do include the vitamin E. So, and it's also a nut-free formula. Well, it's made with coconut, so that's a tree nut technically, but they used to make their things with almond oil and people were having allergic reactions, so they have adjusted their ingredients as well. So, okay, so let's say you've been doing this for 6 months and you're feeling a lot better. What do you do now? Well, you want to, there's 2 things you can do. You can try to just wean yourself off of the cream, so you would be reducing the amount over a period of time. I suggest going slowly, and if you have symptoms that are cropping up, stay at that dose. You're plateaued. You want to stay there for a while and then eventually go back down. If you feel terrible when you go off of it, then maybe your body isn't ready to not have that support yet. Something else that people try is in the beginning, when you're using that DIY therapy, you want to use it throughout your entire cycle. So if you're really sensitive to it, you may skip a period. It's not really a big deal, in my opinion, when you're getting things ironed out. If you really have extreme estrogen dominance, you probably will not miss your period while you're taking the progesterone, and that's another way to tell that you're on the right track. If you're on a whopping dose of bioidentical and you're still getting your period, it can it can prevent pregnancy in some people, so something to keep in mind if you are trying to get pregnant, but it can also help increase fertility if you do this DIY treatment and then later on try to get pregnant. So something else you can do once the 6 months are up is you can elect to only use the cream during the phase where, like, once your period ends and then for that week or so. So some people start the cream on the first day of their period. Sometimes people wait a few days until, you know, they've had like 3 or 4 days of bleeding and then start, and they go until about ovulation time, which, you know, for a typical cycle, or what they call, you know, the average cycle, they would go till like 21 days. You may not know this information unless you're tracking your cycle. So basically you just want to keep it in that first part of your cycle. Once you've hit that second phase of your cycle, whether you're ovulating or not, the last 2 weeks, then you would avoid using it. So I hope that wasn't too confusing. If you feel like you're confused and you need a little bit of guidance, but you still want to DIY all of this yourself, I really encourage you to join the Estrogen Dominance support group on Facebook. It's very helpful. There are a lot of people there who are also DIYers, and yay for medical freedom that we can do this in the United States. So I love that group. There's so much information on there that I've found helpful over the years. So that's it. I hope that this video was helpful. If you have questions, please post them under the video. If these videos are helpful and interesting to you, please subscribe to my channel and please share this. And if you like the video, please like it and leave me a review. I love reviews and I love feedback. So if anybody has any suggestions for me on topics that I can cover in the future, I would love to know. And my next video is actually going to be on some other things we can do to help support our bodies if we feel that we are having estrogen dominance symptoms. So things like herbs and lifestyle adjustments and things like that. So stay tuned for that video next week, and everybody have a great week. Thanks. Bye.